Welcome to the Women's Connection. I'm Barrie-Louise Switzen, your moderator. The Women's Connection is a program about events shaping women's lives and helping one gain authentic power on a personal or professional level. So won't you stay tuned? In 2000, the total number of deaths from heart disease combined for men and women was 709,894. In the same year, the total number of women killed by breast cancer was 42,290. My guest is Dr. Nieca Goldberg, Chief Women's Heart Program at Lenox Hill, and we're going to talk about how to maintain a healthy heart. Doctor, thank you for joining me.
Thank you, Barry.
You wrote a wonderful book, and it's almost like a textbook, called Women Are Not Small Men. What prompted you to come up with this title?
Well, for a long time, I saw heart disease as something that was overlooked in women, and not only overlooked, but underestimated. And third, when it came to women being treated, either diagnosed, treated, or taught about prevention, it was all about things that were tested on men. And it's been quite clear over the last several years. One is that our heart disease is no less important, given the statistics you just gave, and that we aren't men.
That's true. What is the difference between a stroke, a heart attack, and angina?
Okay, well, they all deal with the arteries pretty much that are in our body that are blocked with cholesterol or plaque. A heart attack is caused by the arteries that supply our heart muscle becoming completely blocked, so there isn't any blood flow to a part of the heart muscle, and the heart muscle becomes damaged. The stroke is when a blood vessel to the brain is obstructed, and so there are neurologic problems, so that the brain tissue is damaged. And angina is both a condition and a symptom of a blocked artery, but an incompletely blocked artery. For instance, a heart attack is the worst case scenario. Angina is when you have the symptoms, sort of chest pain, shortness of breath, and they come on with exertion, but then they go away. With a heart attack, when the person has heart attack symptoms, they're greater intensity than angina, and they're relentless.
Oh, wow. Well, what is the average age of a woman having a heart attack?
The average age of a woman having a heart attack is somewhere in her 60s. It usually occurs about 10 years after menopause.
And why has the prevention for heart disease in women lagged so far behind men?
Well, it's a few things. It's one, a lack of awareness. Most women don't think of heart disease as a major women's health care issue, which it is. They're more likely to think about ways that they can prevent breast cancer, osteoporosis, or screen for ovarian cancer. But from the statistics, you see that heart disease is far and away the leading cause of death and disability in women. So one is awareness. The other thing has to do with the medical community. When they go to the doctor often doesn't address heart disease prevention, symptoms, or risk factors with women.
Is that because doctors are mostly male and they don't believe that women have heart attacks?
Well, we don't like to believe that, but in fact, it's largely because very little research has been done on women and heart disease. And so whenever there's not any research done on it, very few doctors will learn about it, because only things that are pretty much fact in the medical literature are taught in medical school. But I do have an interesting statistic. In 1996, about 88% of primary care physicians didn't realize that the warning signs of a heart attack could be different in men and women.
Oh, how nice.
Yeah, so I mean, I think that it's clear that there's awareness issues both by women and the healthcare provider.
Well, we've got to get that out. I noticed in your book you had lots of quizzes, and one of the quizzes that you had that I even took myself was the risk factor. You want to talk about the different risks that women have versus men, or not about men, but just women?
Well, some of the risk factors are shared by men and women, such as high cholesterol, lack of exercise, smoking, diabetes, being overweight. But it's really the intensity of these risk factors that are important. I just talked about risk factors that we can do something about. Also common risk factors are family, history, and age. But particularly what women have to be aware of are the issues of family history. Because if your mother was 60 or less when she had her first symptoms of having a heart attack, or your father was 50 or less, then that increases your risk by 25 to 50%.
Wow.
Those are big numbers.
Well, what about if, let's say, your parents had, well, your mother had heart problems, her father had heart problems, and then her grandmother had heart problems?
Well, they're additive. That actually increases the likelihood that you'll have risk or may have later life heart problems if you don't take charge and try to prevent it. The other thing that's really truly important to women is the whole issue of smoking. Smoking triples a woman's risk of having a heart attack.
Wow.
Yeah, and the thing is that I said the average age was somewhere in her 60s, mid-60s. But the risks start early, and particularly in women who are smokers or diabetics. We actually see heart disease come on even before menopause.
For heaven's sakes. What would you say was the leading cause that changed your beliefs about men and women being treated differently?
Well, I think in medical school, they really didn't teach you very much about men and women being different. In fact, I would sit in medical school and they'd always talk about this typical patient, a 165-pound man. And literally myself, I would sit there saying, what's in it for me? What if I got sick? Because I think we have to really take into account the size of a patient, particularly when we prescribe medications and some of the effects of our therapies. But getting back into why I did it, one of the things that motivated me certainly to be a cardiologist was because my father had heart disease at a very young age, and I was reading articles about it and realized that increased my risk. So I became very acutely aware of this issue and how under-recognized and that they never spoke about it in medical school.
What are the different signs of a heart attack that women have?
Oh, the different signs of the heart attack that women have, instead of the typical pressure in the chest, that middle-aged man clutching his chest with it radiating down his arm, what women can experience are a pressure maybe lower down in the chest, which is easy to mistake that it's a stomach problem, and so you don't go to the hospital. The other is shortness of breath on very low levels of exertion, extreme fatigue on very little exertion, and also an upper back pressure.
An upper back.
It's usually in the upper back, and what you feel is this sensation across your back when you're exerting yourself, and then you rest and it goes away. And angina is described like that, although the word angina really means chest. We call these symptoms anginal equivalent symptoms.
Okay. What is the key for a woman to do when she thinks she's having a heart attack?
If a woman thinks she's having a heart attack, the first thing she should call is an ambulance. I mean, I have several patients who thought about cleaning up their house so that it would look neat while they were in the hospital, but they shouldn't delay, because going to the hospital in the middle of while you're having a heart attack saves heart muscle. We now have life-saving procedures that can open up blocked arteries.
Wow.
If you read recently in the New York Times, there was an article about how balloon procedures to the heart when you have a heart attack are pretty much heart life-saving. And for those hospitals that don't have the balloon procedures, we use clot-busting medicines.
Okay. What should women do to protect themselves from heart disease?
There are several things. One is, I think there has to be a greater effort, particularly in young women, to not start smoking, but ways to stop smoking. And that seems to be more difficult for women, because women tend to smoke in response to stress or anger, or think it's a way to lose weight, but it's none of those things. So we have to deal with the smoking problem. The other is to exercise. And everyone says, I know to exercise, I just don't have the time. But it doesn't have to be something that takes over your life. It's something that you have to live with. And so you have to be physically active. Here in New York City, people walk. Other people do a combination of walking, and even the stuff you do in your house, if you do vacuum your own house, can count as aerobic activity.
Oh, that's terrific.
Yeah, and the other thing is looking at what you eat. First, all of us can eat less. You have to sort of burn off more calories than you take in. So making portions smaller and looking at the content of what you eat. It's important in terms of heart disease prevention to take in a diet that's rich in fruits, vegetables, whole grains, fish, which has omega-3 fatty acids.
Sounds good.
And that's right. And watch the saturated fat, the red meat.
That's not good. I like steak.
I know, but you know, occasionally, even when you're trying to prevent heart disease, you can have a serving of meat. It's just that it needs to be 3 ounces or something like the size of a deck of cards.
That's too small. Would different ethnic groups have different risk factors?
Well, different groups, certainly culturally, depending upon where you live and what some of the environmental habits are in terms of diet. For instance, some Russian people have used to having a high-fat diet. And, you know, if you look at people who live in the Mediterranean cities, that they seem to have healthier hearts, and that may in fact be because they eat a diet, a Mediterranean-style diet, which is what I just described earlier, and that it's rich in omega-3 fatty acids. They use monosaturated fats such as that in olive oil.
Love olive oil.
Yeah, but olive oil can be fattening, so we have to watch the portion size.
Everything's got to be fattening. When my mother was on her special diet, she would always say what she loved she couldn't eat because it was bad for her heart.
Well, you know, I think what we've learned, and at least in Women Are Not Small Men, I point out all those facts. You know, you have to go on and live your life, and you not have your diet and exercise program take you over, or it to be something that stresses you out, because then it's counterproductive. You know, if you eat diets that are very restrictive, it's not likely that you're going to follow that diet for more than a couple of weeks.
That's true. You get tired and you don't see any results, so therefore you want to move on and go back to your old bad habits.
That's right.
You're right about the masquerader. Would you explain what that is?
Well, one of the conditions that has symptoms that are similar to heart attack is a pulmonary embolism, which is a blood clot to the artery supplying the lungs, so that you actually can decrease oxygenation, the oxygen supply to your blood. So it's a masquerader because some of the symptoms that you have when you have a pulmonary embolism are shortness of breath, chest discomfort, pain, just feeling a whole sense of uncomfortable because you lack oxygen and you just are hungry for air. So it's an important issue to think about because there are some risk factors in terms of pulmonary emboli, and you have to get to the hospital for that too, because we have ways to take care of women who have pulmonary emboli. That's oxygen. We also may use clot-busting medicines because it's due to a blood clot. But it's really important to know that things like birth control pills can increase your risk for pulmonary emboli. And what puts you at risk for pulmonary emboli sort of also is being overweight or having a family history.
Wow, that family history, it sounds like everybody better know their family history.
I think that's important. It's a question that always comes up in a medical visit, but oftentimes the patient doesn't know the answer to that.
And sometimes they let it go and the person passes away, and therefore you're stuck with,
That's right.
who am I and what am I?
That's exactly right.
You talk a lot about cholesterol. There's the HDL, which is the good, the LDL, which is bad, then there's the triglycerides, and then there's the, the VLDL, all right, which I don't know anything about that, and then it's the total. So what should somebody be conscious of, and what are the different parts of the cholesterol mean?
It's important to talk about cholesterol because that's one of the things that women are under-screened for. And your first cholesterol test ideally should occur when you're in your 20s. But I know many people are in their have been in their 20s and didn't have a cholesterol test. And so you certainly, if you haven't had one, get one. What we're looking at with the standard cholesterol test, one is it's important for you to take it after you've fasted for 12 hours. I usually tell my patients to, after dinner, not to eat anything, go to the lab first thing in the morning, and then they can eat breakfast. because it's practical. The other thing is that we get levels of total cholesterol, your HDL, which is good, your LDL, which is bad, and your triglycerides. That's the standard cholesterol test. And that pretty much tells us a lot of information about your risk. It's important to have LDL levels that are low and higher HDL levels. In fact, in women, it's good to have an HDL level that's 50 or greater.
Oh, that sounds good. 50 or greater. Is there such a thing as too much good cholesterol?
Well, there are people who have high levels of good cholesterol, but that doesn't necessarily mean that they're 100% immune from heart disease, because it's due to a combination of factors.
What does VLDL mean?
It's called very low density lipoprotein, and that sometimes is part of a more specialized cholesterol test. And it's one of the cholesterol components that is in the blood and helps to carry, triglycerides around, or is a breakdown product.
What role does stress play in managing a good heart?
I think stress is, when it comes to heart disease and stress, it's really underestimated about how it impacts on the heart. In fact, it's almost ironic when women often came in with their heart disease symptoms and they were having a heart attack, the doctor would say, oh, you're stressed out, and give them a prescription for Valium. But now we know a lot more about stress and the fact that it actually does affect the heart. It increases your heart rate and your blood pressure, and we find that women, particularly women who are in an environment where they have low control, where you feel like you don't have control over your job or even your household, seem to have an increased risk of heart attack. The other thing is women who hold in their stress, which is something that as women we're pretty much conditioned to do, hold in our anger. That's a pretty risky behavior.
Well, what about the flip side of that, where somebody lets out their anger? Isn't that classified as a type A personality?
Yeah. Yes, it is classified as a type A personality and somewhat typical, more typical of a man. And although there's a type A component in women, there is a behavior in women that is holding in the anger that's more common. The other thing is that marital stress could also, there were some studies recently that showed that marital stress can bring on or increase your risk of heart attack.
Oh, that's always nice. So what would somebody do? Get rid of the husband or their mate because they're
going to have to find out what it is that's stressing them and deal with that. Now, sometimes the stressor or the thing that pushes your buttons is going to always be there. What you need to do is to figure out how to act differently about it and how to relax. And I have several tips in the book about stress reduction.
Name one.
So, anywhere from yoga, deep rhythmic breathing, meditation, aerobic exercise. For me, aerobic exercise reduces my level of stress.
Well, looking at you, you wouldn't think you had any stress.
Well, I think we all have stress trying to balance a lot of things every day.
They say laughter is the best medicine. How do you feel about laughter relieving stress and tension and everything else?
I think laughter is a great stress reliever. In fact, one of the things we talk about in our program at the Women's Heart Program is, go out and watch a movie that's funny. Rent a funny videotape.
If a woman stays at a healthy weight, which I don't know what the number is on that, eats right and exercises daily, does that mean she'll prevent having heart problems?
For many women or majority of women, that will help reduce their risk. The problem is there are some unidentified factors that we're still working on that increase a woman's risk. I mean, we have some new factors that we're testing for, like homocysteine, an amino acid, which stimulates the buildup of cholesterol in the arteries. C-reactive protein, that's a lot of buzz in the news, which is a protein of inflammation, because they feel that part of heart disease is really caused by inflammation.
Oh, interesting.
And so we're working on that.
Okay.
And so I think we know a lot of things, but we still can learn more.
It's a never-ending process. What should a woman look for when she's looking for a doctor who's a specialist?
Well, in particular, when you go to a specialist, that in a heart specialist, it may in fact mean that you're going for a procedure or you have a condition that is outside the realm of your internist. And when you look for a heart specialist, you really have to look for somebody who's a good listener, because the majority of the information that you get from a patient is from the medical history at the first visit. And so you have to notice if the doctor is listening to you. And, you know, the usual things, if you make a phone call, do they answer the call back? The demeanor of the office is very important.
Mm-hmm.
How friendly, not only how friendly the staff are, but how receptive they are to your questions. The other thing that we have to deal with nowadays, obviously, is managed care. And so you have to really check who the doctors are that are in your plan.
That can be stressful in itself.
That can be stressful in it of itself, and certainly your friends and family members who have been to doctors can recommend them. And if you've been to a hospital, the best person to ask for a recommendation is probably a nurse.
Or somebody who's being discharged.
Oh, somebody who's being discharged.
Many books suggest that you can decrease your risk of heart attack by going on a vitamin regimen. What do you think of that?
I really am a strong advocate against that. It doesn't seem reality-based. Here we are talking about all of these risk factors, Barry, and you think that you can take a series of pills and make them go away? No, I think many women out there are really know this to be true. I think the hard part about heart disease prevention is it isn't packed in a magic pill. And it seems probably to many women like an awesome task, but it's not. In the mid part of the book, I really talk about some exercise programs that are really easy to do with some diagrams. Also give a diet program, so that most people don't realize that all of those studies that come out about antioxidant vitamins and other vitamins are the fact that the studies that have been done are actually that have been done on women who ate those antioxidants in their foods, not taking them as supplements.
Big difference.
There's a big difference. And in fact, what happens is if you take supplements, then you probably are not going to eat some of the things that you're not, that aren't heart healthy because you think that you're protected.
A bigger slice of steak?
A bigger slice of steak.
Or chocolate?
Or whatever. Yeah.
Well, talking about food, being in New York, you work long hours, you work hard hours. You come home many nights, you're exhausted, but you're hungry. And you have to be in bed in like an hour or two. So what is the time frame between the time you grab something quick to eat and the time that you can go to sleep so that it digests?
Well, ideally, you would like to wait well over an hour, even a couple of hours, because you just don't want to lie down after a heavy meal. And you should be able to relax. But I know that for some people that's not a reality. The important thing to do is then eat less or eat a lighter meal. So if you're someone who works long hours, what you should do then is eat your major meal in the middle of the day.
To counteract the hunger pains when you come home.
That's right.
Women in postmenopause have been preached about HTRs, and now the advice is changing. What is your feeling on that?
Again, just like in the vitamins and the supplements, HRT is not is not the magic pill. What I think is that we don't know about hormone replacement therapy as much as we thought we knew about hormone replacement therapy. One is, it's not a good thing to give women who already have heart disease, because we know that women who've recently had a heart attack who then start on hormone replacement therapy actually have increased rate of second heart attacks.
Wow.
And that was a study published several years ago. In healthy women, most of the studies that showed hormone replacement therapy as a heart benefit also were women who went to the doctor more often, who were extremely healthy, exercised, and seemed to have done everything right. And I don't think it represents most women. The other thing, there are a few hormone studies that have been done in African American women or Latinas. So this is all very interesting. The bottom line is that if you think you're taking hormone replacement therapy for heart disease prevention, then you shouldn't be taking that hormone replacement therapy because that's still unproven. Hormone replacement therapy works for menopausal symptoms, and we know it works for osteoporosis, but it's not been proven for heart disease.
Wow, I think you're talking about women not being aware of their bodies, and some people are. I think that the roles are changing now. People are becoming more acutely aware of their bodies. I think because there's so much in the newspaper, television, and we're living longer. So it's a lot of things that our parents never talked about and we're going through, and it's like...
Our parents never talked about these things. They never talked about illness. And now
true.
why it's so important is that 50 million women are going to turn 50 this year.
Wow.
And that's truly important. And the women who are turning 50 this year are probably the women who are most health conscious.
What about white wine and red wine? There's been a lot written up about red wine and the attributes of drinking a glass of red wine at dinner.
Well, we still don't tell people to start drinking to prevent heart disease if they don't always drink. But the thing about red wine is it has antioxidants in it. Mm-hmm. And alcohol in general raises HDL cholesterol. So you get the benefits in the white wine of the increase in the HDL cholesterol, but it's the red wine that also has the antioxidants. But for people who don't drink, does that mean you're being left out? No. You can drink red grape juice, you can eat red grapes.
What would you like to leave the audience with?
Well, I really think that women need to understand and need to think about heart disease as a major women's health concern, because I think until all of us believe that, we're still going to be treated as small men when we have our heart disease.
Doctor, I thank you so much for
Barrie.
joining me. This has just been so terrific, and I love your textbook.
Thank you.
Women Are Not Small Men. Thank you for joining us. I look forward to hearing your comments and hope you are keeping a healthy heart. Bye now.